If you deal with melasma, there are certain mistakes that I see people make time and time again that not only prevents them from improving, but also sometimes makes their melasma worse. Hey, I'm Dr. Sam Ellis. I'm a board-certified dermatologist in Northern California, and my goal is really to help you understand your skin and find products that work for you. So if that sounds good, give this video a thumbs up and don't forget to subscribe to the channel. Before we get into the melasma mistakes that I see people make time and time again, I thought we should talk a little bit about what melasma actually is. So melasma is a condition of hyperpigmentation, or increased melanin or pigment within the skin. And depending on your baseline skin color, that can look like brown patches and sometimes even bluish or grayish patches on the cheeks, the forehead, the upper lip, sometimes even the chest and arms. We don't fully understand why some people develop melasma and some don't, but we do realize that there is a very strong genetic predisposition, and then things like UV radiation as well as hormonal changes can trigger the melasma to show up in the skin. Melasma tends to be more common in women than men, and also more common if you have a baseline deeper skin tone. It also tends to show up in your 20s and 30s, but really you can get melasma anytime in your adult life, particularly if you have a specific trigger like pregnancy or start a birth control pill. The reason I think it's really important to review melasma mistakes is because I see a melasma patient, actually probably many melasma patients in my clinic every single day, and there are certain things that come up time and time again that really get in the patient's way from being satisfied with their improvement or making any improvement at all. And I think with that, we'll just jump right into the mistakes so we can start learning from them. So mistake number one that I see is that people are searching for a cure, a permanent solution for their melasma. And this is why that is a huge mistake. The reason I say that is there is no known cure for melasma. I think of melasma as a chronic skin condition, meaning that once you develop melasma, you have it to some degree for the rest of your life. Now, that doesn't mean you can't make it significantly better, but the thought that you will have melasma, treat it, and then never deal with it again is sort of the wrong expectation to have. Now, that's not to say that you can't have a bout of melasma in your life and for your skin to essentially go back to baseline afterward, but you will always have that kind of increased tendency toward developing pigmentation. And the reality is, for most people who develop melasma, they will always have some degree of hyperpigmentation, but that can come and go over time. And the reason I wanted to point this out as a mistake is because if you understand that melasma is a chronic condition that you will likely be dealing with on and off over the course of your life, you're going to approach treatment differently. Because I have a lot of patients who come into my clinic, I'm maybe their second or third opinion about their melasma, and they'll tell me, well, I had melasma, I did X, Y, or Z intervention, it got better, and then I stopped the treatment, and now my melasma is back. And they're really frustrated, and I'll get into this a little bit later. It's because they didn't really have like a long-term plan for how to deal with their melasma, and they were just really upset that it wasn't cured. So understanding that melasma is not curable, but is treatable helps you set up the right expectation for interventions. And I think that's a really nice segue into mistake number two that I see with melasma, which is not having a long-term treatment strategy. When I work with my patients who have melasma, we sort of divide their treatment into two categories. One is if their melasma is flaring, and what are we going to do then? And what are we going to do for maintenance? There's never a time where they are not treating their melasma. It's just that the interventions might be different if they're dealing with a lot of pigmentation versus that pigmentation is under control and they want to maintain it. Oftentimes, this means a patient will be on sort of a more involved melasma regimen for a few months. They might be on topical medications plus skincare, maybe even an oral medication. And once their pigmentation is well managed and we kind of hit a plateau in their improvement, we can transition them to a maintenance phase. And like I said before, melasma can come and go depending on certain triggers. And so we can stay in that maintenance phase until a flare happens again, which sometimes feels a little bit inevitable. It's not uncommon for a patient to come in and say, Dr. Ellis, I've tried X, Y, and Z topicals for my melasma. I'm ready to cure it. I want to do a laser, or I'm ready to do chemical peels. Or they might have tried a laser and a chemical peel in the past and not seen the results they were hoping for. And that's always when I reiterate to them, even if they saw temporary improvement with those types of procedures in office, they need to be on some type of skincare to maintain it. And it's often my preference to lead with skincare and sort of what I would consider a medical intervention, and only use those cosmetic interventions like lasers or peels as sort of like a supplementary treatment. Even as someone who does a ton of cosmetic dermatology, lasers and peels and in-office procedures are not always the answer. And I think a lot of people want to take that plunge into doing a laser or doing a peel or a series of peels or lasers because they essentially tell me, hey, I've been treating my melasma for a really long time and I don't really want to do it anymore. So I'm ready to pay for a procedure and just get it done so that I don't have to do any maintenance. And that will never, ever be the case with melasma. You always need to maintain no matter what intervention you're starting with. In that same vein of talking about maintenance and sort of keeping up with your melasma treatments, the third mistake that I see all the time with melasma is not wearing sunscreen. And honestly, this one kind of blows my mind. UV radiation, so like sunlight that you get on a day-to-day basis, is the #1 trigger for melasma. Even if you're someone who never really wore sunscreen consistently and your skin kind of tanned and you did just fine, once you have a diagnosis of melasma, you need to be so consistent with your sunscreen application. I've seen patients invest thousands and thousands of dollars in their melasma journey and then have one sunny vacation or have a few days without sunscreen and everything comes back. And that's a really frustrating thing. Like, that is totally not fair. And that's why melasma is one of the most frustrating conditions that we treat in dermatology. But it's so essential that you are protecting from the sun. And I've had people go, okay, well, Dr. Ellis, I don't really like to wear sunscreen. So like, what else do you have for me? And honestly, like, don't bother treating your melasma if you're not going to protect your skin from the sun. Sometimes I get some pushback on wearing sunscreen. They say they don't like it, how it feels, it's too expensive, all these things. So at that point, I kind of discuss with my patients, well, no one dies from melasma. It is super like mentally frustrating to deal with it, but physically it doesn't hurt you. So if you're willing to have a little bit of excess pigmentation and you don't want to wear sunscreen, that's fine. But that's usually not why the patient is sitting in front of me. They're sitting in front of me because they're really frustrated by their pigment. And so using sunscreen in melasma to me is like using medicine. I really think of it as one of the most important medical interventions you can make for your pigmentation. Once I have someone on the sunscreen train, and oftentimes actually a lot of people who do come into me, they take really good care of their skin, they're looking to optimize their skin, they are wearing sunscreen, but the mistake that they're making is they are not wearing enough sunscreen. One thing I started doing in my melasma consultations is actually pumping out sunscreen to demonstrate to my patients how much they need to use. When I'm teaching residents, so dermatologists that are training to become board certified dermatologists, I always encourage them to dig deeper with their patients and really get more details, because for a patient to tell me, yes, I'm wearing sunscreen, that's not enough. I want to know what sunscreen you're wearing, how much you're putting on, how frequently, because those are all really important things when you have a sun sensitive condition. And this is what I'll tell you, 10 out of 10 times when I demo for a patient how much sunscreen they should be using, they will say something like, oh, whoa, that's a lot more sunscreen than I use, or, oh, that's how much I'm supposed to be putting on. So I really want to reiterate that it's not just about the act of putting sunscreen on, but you have to put on enough to actually get protection from it. If you're someone who's dealing with hyperpigmentation or melasma, I recommend a minimum of a 1/4 teaspoon of sunscreen just for your face. And sometimes a 1/4 teaspoon feels like a lot. And if it does, I recommend applying your sunscreen in 2 layers. So take about half that amount, apply it to your face, and then take the other half and apply it like that. And that will prevent it from feeling a little bit too heavy, and it'll make sure that you're applying it evenly. But I'm serious, if you are not sure if you're applying the right amount of sunscreen, like, measure it out, get that 1/4 teaspoon out and know exactly what you need, because I feel like that under application of sunscreen is a detriment to improving your melasma. So aside from just applying enough sunscreen, you also need to reapply your sunscreen every 2 hours if you are outside. And I will admit this, as a dermatologist even, I'm not great about reapplying my sunscreen throughout the day, but if you're someone who struggles with melasma and you really want your melasma to get better, you need to be better about your reapplication and really take it seriously. And I'm gonna film a whole video on how to reapply your sunscreen over makeup, so make sure you're subscribed so you don't miss that. Now, mistake number 5 might feel a little bit counterintuitive based on what I just said, but mistake number 5 when it comes to treating melasma is relying exclusively on sunscreen for your sun protection. I cannot emphasize this enough, and it's why I've dedicated multiple mistakes in this video to sun exposure, but if you are getting too much sun regularly, your melasma will not get better, and it certainly could also get worse. And I think sunscreen is so important. It's a huge staple in terms of sun protection, but it is not the only way you can protect from the sun. So thinking about things like wide brim hats, and honestly, most importantly, seeking shade when you're able to. I'm thinking of one of my melasma patients right now who for like months and months was not getting better with her melasma, and she was telling me that she was wearing sunscreen, and then we realized she was like standing out on the pool deck watching her daughter play water polo, and she wasn't wearing a hat. The sun was reflecting off of the water and hitting her in the face. For her, we not only added a hat to her regimen, but I literally told her like she needs to sit in the bleachers in the shade. And of course, I don't want to mess with someone's lifestyle. I don't want you to feel forced to do anything. You just have to know that sun protection is such an essential part of melasma treatment that you need to take it so seriously if you want your melasma to get better. But it's always a balance, right? Like if she said, no, Dr. Ellis, I want to be right up on the sidelines watching my daughter play water polo, that's fine. That's her prerogative, but she just has to know that her melasma might stagnate in terms of improvement too. All right, I'll give the sun protection a rest. Let's move on to the next mistake, which is treating your melasma while being on birth control. The reason this is a mistake is because both estrogen and progesterone, two things that are found in birth control pills, can drive the melasma process forward. The way I explain it to my patients is you're trying to push the brakes on your melasma, but your foot is still on the gas pedal if you're on a birth control pill. And really this extends beyond just birth control pills. So if you're on a hormonal IUD that uses a form of progesterone, that can also drive melasma. Also for patients who are in their 40s or 50s, or I guess I shouldn't really age limit people, but if they're on hormone supplementation to help with things like their sex drive or their fatigue or menopause symptoms, that can also trigger melasma. So if you're on injectable, topical, oral estrogen or progesterone in any form, your melasma might get worse and also your improvement will be stifled. That also kind of references back to my point of the fact that if you're treating your melasma, it also has to work into your lifestyle. So if your birth control pill or your hormone supplementation is really enhancing your life or contributing to your life in a way that you don't want to stop it, that's totally fine. You just have to understand that your melasma might not improve the way you want it to either. Life is full of lots of hard choices, and sometimes things that benefit our overall well-being are not the best for our skin. And it's really up to you to decide what decisions make the most sense for you and what your goals are. Now I want to pivot a little bit to treatment and what we do to treat melasma besides sunscreen, because truly sunscreen is a treatment for melasma. And that's mistake number 7, which is not using prescription topicals. The gold standard holy grail treatment for melasma is a combination topical that has a retinoid, typically tretinoin, as well as hydroquinone, which is a pigment blocker, as well as some type of anti-inflammatory to prevent irritation from hydroquinone and tretinoin. And this is really well-known information. People who treat melasma on a regular basis will know to recommend this, and many patients who see me in my office have already tried some version of this at some point. And honestly, a lot of them have improved on it in the past. But like I mentioned earlier, they were sort of expecting a cure and didn't realize that they might need to cycle on and off this type of topical medication. Or I have people who are nervous about using these topical medications and they've been trying a lot of over-the-counter things that don't have these essential ingredients and they're not getting to their goals. And that's where they need to bring in prescription medication. Now, don't get me wrong, there are other pigment-fighting ingredients that you can find in drugstore products or online that can be really helpful with melasma and blocking pigment, like vitamin C, kojic acid, licorice root, arbutin. There's a ton of them, but none of those are going to move the needle as much as prescription tretinoin mixed with hydroquinone, or just being on tretinoin or just being on hydroquinone. But honestly, if you're open to doing both at the same time, that's the way to go. One thing I also think is worth noting is that the tretinoin strength as well as the hydroquinone strength within that topical can be altered. So you can have 0.025% tretinoin, you can have 12% hydroquinone, 2%, 4% hydroquinone. And so really finding the right balance and concentration that works for you and your skin and isn't too irritating but is still effective is something you can work with your doctor on. It's not uncommon for a patient to be wary about incorporating hydroquinone into their skincare routine. Maybe they've heard some bad things about it, and it is a powerful medication, but when used under the supervision of a doctor or someone who prescribes it all of the time and it's used correctly, it's completely safe. And it's also incredibly effective when used the right way. Now, if someone has tried topical retinoids and hydroquinone and they haven't gotten the results that they're hoping for, or maybe they have certain reasons why they can't be on those medications, I do want to bring up something else, which is oral medication. And that takes me to mistake number 8, which is not considering oral tranexamic acid for the treatment of melasma. Now, I could honestly dedicate an entire video to oral tranexamic acid, and if you want more details after this, let me know and I can make that video. Oral tranexamic acid is used outside the realm of dermatology to help with blood clotting in people who have heavy bleeding and controlling that. But at much smaller doses, we found that it is incredibly helpful for the treatment of melasma. I won't get too into the science right now, but essentially oral tranexamic acid works on how your skin cells, your keratinocytes, communicate with your melanocytes or your pigment producing cells. And it sort of stops that crosstalk in between them so your melanocytes don't overproduce pigment. Now, oral tranexamic acid is not for everyone, so it's really important to discuss this with your doctor, but I find that a lot of patients come to me for their melasma and oral tranexamic acid has never even made it into the melasma discussion. So if you're learning about tranexamic acid for the first time right now, bring it up with your dermatologist. So we've reviewed how UV radiation can stimulate melasma, hormones can stimulate melasma, and not keeping those under control can prevent you from getting better. But another mistake I see is not avoiding excess heat or blue light if you struggle with pigmentation. I find that heat and blue light are two triggers of melasma that aren't discussed as much, and probably for good reason. They're not as strong of triggers for melasma as UV radiation and hormones, but they still deserve attention. Over time, we've realized that melasma and that pigment you produce is somewhat driven by the microvasculature or the tiny little blood vessels in your face. And things that increase heat in the body can cause those little blood vessels to dilate and stimulate that pigment production process. Now, I'm not telling you to go out and never get get hot again. But if you have certain activities that you do, like hot yoga, or you like to exercise midday and it's really sunny, or you like to do any type of like heated activity, you may want to cut back on that if you're struggling with your melasma. And then the other trigger I mentioned was blue light. And blue light, if you think of like the entire electromagnetic spectrum, sits right next to UV light. So blue light and UV light are very close together. And we found that in people with deeper skin tones, blue light, which is part of the visible light spectrum, can also stimulate melasma. And the number one place you get blue light exposure from is actually the sun, the visible light coming from the sun. You get small amounts of blue light that come off of your devices like your computer or your phone, and that's really not enough blue light to be problematic. So I don't want you to worry about, there's other reasons we shouldn't be looking at our phone so much, but blue light exposure is not really one of them. So when we're thinking about protecting from blue light, it's really the blue light from the sun that I'm talking about. And the ingredient that protects you from blue light exposure in your makeup or in your sunscreen is iron oxide. Iron oxides are what give cosmetics and skincare pigment. So if you think about foundation, concealer, tinted sunscreens, those are all good ways to protect against blue light. I do want to reiterate, blue light has only been shown to be problematic if you have hyperpigmentation and you have a medium to deep skin tone. If you have a fair skin tone, blue light doesn't seem to be a trigger, and so iron oxides incorporated into your skincare or makeup routine are less important. So really a lot of the mistakes that I see as a dermatologist when it comes to treating melasma and seeing a ton of melasma patients is either mistakes around the expectations to have around melasma, how to protect yourself from melasma, or not optimizing your treatment interventions. If you've ever received any tips that have been helpful for your melasma, or you have any questions about melasma, definitely put it in the comments below. As always, thank you so much for being here and for watching. Don't forget to give this video a thumbs up and subscribe to the channel, and I'll see you next time.